We'll start.
Yeah.
Good morning and welcome to each one of you for the Medifit Live today on a Sunday cloudy morning. Medifit Live is an educational initiative by the Medifit Clinic to spread awareness about the importance of metabolic health. It is a key in managing your medical disorders. The Medifit Clinic is a metabolic health clinic based in Bangalore. We are a comprehensive team of medical professionals practicing nutritional medicine, exercise medicine, and lifestyle medicine. I welcome Dr. Bharath and Dr. Anupama, our speakers for today.
Recording in progress.
Dr. Bharath is a specialist in sports medicine who has been the team doctor of Indian boxing team. He has worked with athletes like the legendary Mary Kom and also Nikat Zareen, who won gold for India at the World Championships and the Commonwealth Games. He is also the founder and medical director of the Medifit Clinic and a staunch advocate of nutrition, exercise, and lifestyle as medicine. We have our guest today is Dr. Anupama, who is a trained gynecologist from Royal College of Obstetrician and Gynecologist, UK. She is also trained in lifestyle medicine from International Board of Lifestyle Medicine, USA. She treats PCOS routinely in her clinical practice. So we have a very interesting topic today, PCOS, which is a leading cause of infertility in women of childbearing age. 1 in every 3 women have some or the other symptoms of PCOS and represents 80% of anovulatory infertility cases. More than 75% of individuals do not receive a timely diagnosis from their healthcare provider. So this is especially concerning because of the impact that PCOS can have in infertility, mood, and quality of life. In today's discussion, we will have a brief overview of how to recognize PCOS, discuss the currently available treatment options, and most importantly, how PCOS can be managed with nutrition, exercise, and lifestyle as medicine. So over to you, Dr. Bharath.
Thank you, Seema. A warm welcome to everybody on a Sunday morning. So I will straight away talk to Dr. Anupama about the topic today. So Dr. Anupama, welcome to Medifit Live. And the first question for you today would be, how does one know that they have PCOS? So how do we diagnose or even recognize PCOS?
Right. So, first of all, I'd like to begin by thanking you all, the Medifit team, for having me. It's a pleasure to be here on a Sunday morning to discuss this very, very important topic with all of you. Yes, it's a good question. It's important to know about PCOS. The awareness has definitely gone up because unfortunately, it's so common today. It's one of the most common endocrine disorders in women of the reproductive age. So anywhere between 15 years of age to 50 years of age, women can be diagnosed with PCOS. So depending on their age group, they can present with various symptoms. So if it's a young girl, most likely they would come with irregular periods and putting on weight, acne, or excessive facial hair or excessive body hair. And a little bit later on, if they're trying to get pregnant, it could cause some difficulty in getting pregnant, so they might present with that. It can also cause insulin resistance. It's most commonly associated with insulin resistance, so they can have pigmentation of the skin on the sides of the neck or underarms. So usually these are the most common symptoms that women can present with. Yeah?
All right, so is there anything specific that we would look for in the blood test that we do or the ultrasound scan that we do? Because most often there are symptoms, but then there is nothing on the scan or the blood test, or it may be the other way around also. Okay, so they find, they do an ultrasound scan for something else and then they find polycystic ovaries, but then they are completely not aware. It comes out as a shock.
Right.
So what do we do in such cases?
So it is important to be aware that not everybody with a scan report showing polycystic ovaries has polycystic ovarian syndrome. So the diagnosis of PCOS, first of all, begins with a complete history and examination. Important to rule out. It's important to remember that it's a diagnosis of exclusion. So if at all someone's come to us with irregular periods, you have to rule out any chances of thyroid abnormalities or prolactin abnormalities, which might be causing the irregularity, before actually concluding that this could be PCOS. So there is something called the Rotterdam criteria for diagnosis, which is accepted world over today. Basically, you have to have 2 out of 3 conditions to fulfilled to diagnose someone or label someone as having PCOS. So what are these 3? One is symptoms of PCOS could be irregular periods. The second one could be clinical or biochemical signs of hyperandrogenemia, which means they could have acne or hirsutism, excessive facial hair, or a blood test showing increased levels of male hormones, which could be testosterone, or free androgen index can be calculated. And the third one is the scan. So any 2 out of 3 have to be met to label someone as having PCOS.
All right. So now that we know what PCOS looks like and how it presents like, now we often wonder what is the root cause. Now we also have a genetic predisposition. Is that correct?
Yes. Unfortunately, we don't know exactly what is the root cause of it, but it is linked to genetic inheritance because it tends to run in families. So if you have a mother or a sister with PCOS, you're more likely to develop PCOS. So it's important to be aware of that. Apart from this, it is also associated with the lifestyle. It's become more common because of the diet and the food that we eat, the weight, which seems to amplify the condition and the symptoms of this condition. So it's classified more like a genetic or a lifestyle disorder.
All right. So now, let's say somebody does not have PCOS, or they do not know. But then, are there any conditions that come associated with it? As in, like, let's say somebody is putting on weight, should they suspect PCOS and then get themselves tested for it, or even go through a screening criteria?
Yes. So PCOS is associated with weight gain. Okay, it's an association only. There is no evidence to say that having PCOS leads to weight gain by itself, or that it makes losing weight difficult for these women. So also insulin resistance, as I was mentioning, can be commonly associated with PCOS. So it's a good idea to have a glucose tolerance test or a HbA1c done for these women because they're more prone to develop diabetes later on in life also if they have. It's like a non-modifiable risk factor for developing diabetes in future. Apart from this, blood pressure, again associated with lifestyle, weight and all of these things, sedentary lifestyle. The blood pressure, these women are more prone to develop high blood pressure and heart disease later on in life. Yes.
All right. So just to add to your point here, there is a research which says people who have PCOS have 7-fold risk in developing diabetes, and they are about 4-fold increase in the risk of developing metabolic syndrome. Now, which is again the root cause of things like heart disease and stroke, etc. So this is the risk that we have. So the point to take away here is that even if you have PCOS, don't just look at it like a PCOS, but look at it like a metabolic condition that needs to be reversed in association with others so that you do not develop further complications. So that is the takeaway that I get here.
Absolutely.
Okay. So now, right. So the next question is, now that we've identified it and looked around the associated medical conditions, so how should we, why should we treat PCOS? It is just a collection of symptoms, right? Yeah, you are at risk of diabetes and other things. So what happens if we don't?
Right. So to put it simply, I think PCOS, as we said, it affects women in the reproductive age group. And based on this, they might present with various symptoms, and it impacts long-term, health, and it has major consequences later on in life as well. It's very important to identify and do what you can do about it, right? So let's say someone comes to us at a younger age group, they might be having irregular periods. and they might be putting on weight, inability to lose weight. So these children or late teens can be having body image issues. They can have depression, anxiety, and they seem to struggle with all of that. And later on, let's say the same person comes back trying to get pregnant, and she's not able to get pregnant. So it is shown that these women, even if we help them to get pregnant with some medication and treatment, there's a slightly increased chance of having an early miscarriage in these women. And even in pregnancy, they can develop gestational diabetes, which because of PCOS, they're more prone to develop gestational diabetes and pregnancy-induced hypertension. They're more at risk of having a low birth weight baby and IUGR, even in pregnancy. And after delivery, again, later on in life, they can, develop diabetes, type 2 diabetes. They can have high blood pressure and heart disease. And these women, even if they're not very overweight, they are known to be associated with having sleep apnea. So it's important to ask these patients if they have snoring or daytime sleepiness, drowsiness, because if that is there, that needs to be identified and treated as well. So apart from this, it's important to remember that later on in life, if somebody is not having regular periods, they're more prone to develop endometrial carcinoma as well. So women should have at least 4 periods in a year, because if the endometrium is not shed in the form of a menstrual cycle, at least once in 3 to 4 months, it can develop into hyperplasia and atypia and lead to endometrial cancer. So as you can see, it has so many implications all through a woman's life, not to mention the heart disease, which comes on later. So.
Yeah, so right from menarche to menopause and then even then beyond, so PCOS has a lot of high-level implications. So
Yes.
now, just a special mention about infertility here. Now, we've seen a boom in the number of infertility centers that have actually come up. I mean, it was 10 years back, the number of infertility cases was very, very less, and then we rarely had a infertility center. But then now that IVF and then IUI have gone up, so the question here is how important is PCOS and reversal in relation to infertility? Is it that both should go hand in hand, or you fix your PCOS first and then go for the infertility treatment? So what is the verdict?
Right. So for PCOS, if somebody is diagnosed with PCOS, lifestyle modification is the first line treatment. In fact, it's the only treatment. Anything else is only medical treatment is only going to help one to manage that particular symptom. So if you have irregular periods, I give you medication so you can have regular periods. But it doesn't affect or affect the root cause of the problem. So the way to treat the root cause of it, to set right the hormone imbalance, is with lifestyle modification. So it's very important to keep that in mind. And definitely, as you said, with regards to infertility, I think if somebody is trying to get pregnant or wants to be a mother, the best way to start off is by taking care of your own health. Then you will have more likely to have a safe and smooth pregnancy, and the baby, unborn baby, also has a best opportunity to have the best. So definitely, I would say lifestyle modification has to come hand in hand. If not, let's say if somebody is very old and 36, 37, and they don't have the time and they're worried about that, then maybe it can go hand in hand. But otherwise, for young people, definitely lifestyle is the first line.
I am very much in tune with you. This reminds me of an example of my friend who's trying for a second baby after a span of 10 years. So he is overweight, his wife has allergy issues, and she is overweight. So they were trying for a baby, and then it is not happening. So they were trying a lot, and in fact blaming the gynecologist as like not doing anything. Then the moment I looked at them, then I mentioned, look, both of you are not even fit to be a mother and father. The best thing that you can give your baby is a good set of genes. So fix yourself first, okay? So take care of your metabolic health first before you even try for a baby, isn't it? It is a risk to both the mother and also the unborn child, and then even before birth and after birth, isn't it? So it's so important to fix your lifestyle first. So, okay, so going ahead now, what do you think is the conventional gynecology treatment that is existent today?
Yeah. So when it comes to PCOS, depending on the symptom, we can treat whatever symptom. It usually addresses the symptom that they're having. So specifically, if you're asking me about infertility, it's due to anovulation. These women have multiple cysts in the ovaries and multiple follicles develop, but none of them reach maturity, and these women don't ovulate at regular intervals, which is why they find it difficult to get pregnant. So when in that sense, we help these women to get to ovulate, which means we can give them clomiphene citrate maybe or letrozole 5 days in a month, starting at the beginning of the period, and also help them with some other injections to help them to ovulate. So many a times women with just this much do get pregnant. But like I said, again, they're still at risk of other things even after conceiving. So in terms of infertility, that is the treatment we offer.
So you're saying that even so they get lucky and they get pregnant, but then the metabolic health is still poor.
Yes.
So absolutely. We need to fix that before we do anything else, isn't
absolutely.
It?
Yes.
All right. Okay. So now, now that we know a lot about PCOS and what it does, okay. So you are a wonderful combination of being a gynecologist and a lifestyle physician. So what do you think is, how different is a lifestyle medicine approach as compared to the conventional approach? So we gynecology also mentions about lifestyle modification, but then there is no great detail about why, when, and what. But then that is mentioned in in the lifestyle medicine. So how do you think it helps?
Right. So I wouldn't say it is different. They both go hand in hand. Lifestyle medicine is using, evidence-based protocols in lifestyle, which are helpful to maintain your overall health. So even in PCOS, the metabolic abnormalities can be set right with lifestyle. How is it different? It's not very different. The thing I would like to highlight here is, until I studied lifestyle medicine, it's very easy to write on paper lifestyle modification, or just say avoid junk food, eat healthy, exercise more, and then the patient walks out. But then I think there's a lot of unawareness. People are not aware what lifestyle medicine is or lifestyle modification actually entails. So in lifestyle medicine, we talk about 6 pillars. Food and exercise are very important, obviously. Apart from this, we also stress upon the importance of sleep, stress management, avoiding alcohol and smoking and other risky substances, and the importance of social connections as well. So positive social connections are also a part of our living a very healthy, good quality life. So we focus on all these 6 areas to help some women, help people in general live better quality life.
All right. So that was a very good insight. So now, in a short while, I will be highlighting the features of what exactly we need to do or fix in terms of nutrition and exercise and lifestyle. So let me give Dr. Anupama a short break from talking, and then let me take over. So first thing, when we talk about lifestyle medicine, 3 things. Now, your nutrition is about 70%, and your lifestyle is another 20%, and then the 10% is only exercise. But as of today, exercise is being abused. When we say abused, so people talk about calories and calorie counting without even giving importance to the quality of the calories that you take in. So quantity is not so important when you talk about the quality, right? So today's nutrition, okay, especially if you look at our own plates, okay, so it is, we talk about when we talk about nutrition, we look at macros and micros. Okay, now macros are basically, we have 5 things, which is your carbohydrates, proteins, fats, fiber, and water. And micros are basically vitamins and minerals. So the calorie counters are simply talking about macros and ignoring micros. Okay, just a simple example would be 100 grams of rice and 1 egg both have about 75 to 80 calories. But the effect of 100 grams of rice and 1 egg on the body, okay, is completely different. So for a calorie counter, both are the same, isn't it? So now we need to change our mindset in looking at the nutrition. Now, a person who's having a metabolic disorder, okay, let's say a PCOS in particular, their diets are very high in carbs, about 70 to 80% high in carbs, and extremely low in protein, and high in fat. Now, when I say high in fat, it is particularly high in one particular type of fat called POFA, which is a polyunsaturated fatty acids. So, logically speaking, we are in a state of energy excess and nutrient deficient. Okay, so when the body is hungry, it is asking for nutrients, not calories, not energy. So optimizing energy and maximizing the nutrients is should be the goal of any nutrition, right? So what are the recommendations here? Now the recommendation again is completely goal based. It should be driven by the data. Okay, when we talk about data, what is your height, what is your weight, what is your body fat percentage, how much of muscle mass do you have, what is your visceral fat, what is your waist circumference, do you have central obesity? Okay, all these things matter in making a diet plan. Okay, so one size does not fit all. Simply putting in all the numbers and then taking all the total energy expenditure and then splitting it up does not help, right? So we'll come to the micronutrients later. So now the recommendation is low carbohydrate, moderate protein, and fats to satiety. So that is in simple one thing. Drop your carbs, increase your protein, and just add fats just to satiety. Okay, so that is the norm. So how much of carbs? Okay, so coming into the specifics, uh, 25% of your total energy intake should come from carbohydrates, and it should be the quality over quantity. All right, so quantity is 25% of your total energy intake, and quality is you prefer uh, complex carbohydrates over the refined carbohydrates. So today we see a lot of people eating pizzas and burgers and French fries. So these are basically junk. Okay, so these cannot be classified as foods, right? So, but then again, there is a tussle over rice versus wheat. So that is another story. But first thing first, prefer complex carbohydrates over the refined variety. Cut down all your flours, cut down all your sugars. Okay, so that is the thing you need to do that. Now there is always for every nutrition there is a quality, quantity, and a timing. Now there is a way that carbohydrates can be strategically used to help you. Now, for example, a small amount of carbohydrates at dinner will help you sleep better. So if you are able to sleep better, okay, so then that is a good quality carbohydrate and it is a strategically timed, right? But in this current scenario today, we wake up and have a coffee which is loaded with sugar. Now that is not a good carbohydrate. That is not a strategic use of carbohydrate, right? So coming to the protein part of it, okay, so what research says is 18% of total energy intake is the minimum quantity of protein that is necessary to maintain reproductive function. Anything below that, okay, is bad. So 18 to 20%, okay, so which still is a part of the balanced diet, is what is necessary. Now, again, today's world, okay, we are in all those vegan lifestyles and plant-based things. Okay, so plant-based proteins versus animal-based proteins. See, any protein has to have complete essential amino acids in the right quantities, and it should have high bioavailability. When this is very important. High bioavailability means whatever you eat should be available or absorbed into the bloodstream and for it to be utilized. So you can eat a lot of proteins, but then if it is not absorbed, it is not bioavailable, then it is absolutely of no use, right? So the highest bioavailability comes from the animal-based proteins, right? So timing here in protein actually does not matter. Okay, so now there is this concept of post exercise workout shakes and pre-dinner workout shakes, post-dinner workout shakes, and all that. See, the anabolic window is open for 48 hours for protein. So you can consume the protein anytime, okay, as long as it is spread out throughout the day. So there is no timing about protein. So we'll get rid of that. Now coming to fats. Now fats are just to satiety. Satiety as in when you eat, you need to be full for a minimum period of 4 to 6 hours. So that satiety is provided by the fat and also protein, maximally by protein and to some extent by fats. So fats are to be for satiety. You don't need to load up your diet on fats. And when it comes to quality, decrease your polyunsaturated fatty acids. So today we are using sunflower oil, safflower oils, and other vegetable oils which are loaded in omega-6 fatty acids. Now, omega-6 is pro-inflammatory, which means it increases your inflammation, and omega-3 decreases your inflammation. So the ideal ratio of omega-6 to 3 is 5 is to 1. So you can go back and Google what is the ratio. So it is somewhere between 30 is to 1 to 50 is to 1. So we are simply fueling the inflammation, and then we are only screwing up our metabolisms by using inflammatory oils. So don't fear the saturated fats. Now traditionally we've been using ghee and coconut oil over decades, centuries. Okay, so it has been thousands of years. So it has been used safely, and then they are one of the safest cooking mediums because of their high boiling point. So there is no need to fear if it is used in the right quantities, right? And then when it comes to fiber, now along with the protein, the other thing that is deficient is fiber. So when you go for a refined variety of carbohydrates, so the fiber is non-existent, right? So we are in the era where we tend to prefer the fruit juices rather than eating fruit. So the fiber is already digested or it is like thrown away. So we need to get at least 30 grams of fiber for a diet to be healthy. Now coming back to the quality, so we need both insoluble fibers and soluble fibers. So there is as such no timing about the fibers. So these soluble fibers and the complex carbohydrates, so they also work as prebiotics. Okay, so prebiotics is food for the gut bacteria, which are called as probiotics. So if at all we have a gut infection, so we have to start eating more of these prebiotics so that the gut bacteria starts regenerating. Okay, so that is the pre and probiotics. So there is something called as microbiota accessible carbohydrates. Now let's say you take sugar or even the flours. So the absorption or the assimilation happens in the upper gut itself. It is not even reaching the lower gut. So the lower gut has the maximum amount of microbiota, which is going to help us. So if the carbohydrates do not reach there, there is no way that they can thrive. Okay, so then the pathogenic or the disease-causing bacteria actually starts thriving, and then metabolic health goes for a toss. So prefer complex over the refined. Okay, so cut down on your refined or eliminate it altogether. There is no need. There is no need of sugar for life. So this is about nutrition. So coming to supplements. So there is evidence that certain supplements like chromium and inositol, so they have additional benefit in people with PCOS. Again, so these things are found naturally in foods. Okay, so you need to speak to your nutritionist to include these kind of rich foods. And if you are drastically deficient, let's say your blood shows deficiency, so we have to include certain supplements, right? Then coming to the micronutrients, now it is impossible that we get into the dose for each, but vitamins and minerals are found in fruits and vegetables. So take in a lot of fruits and vegetables. And nuts and seeds are a very good source of minerals and good fats, right? So a handful of nuts is what you need for the day. Okay, so pick up the handful of nuts and keep munching it, or you can in fact dehusk it and add it to your smoothies, not the green smoothies. You can add it to your whey protein or other kind of smoothies. So, or you can make a protein bar out of it and then use it. So that is good for you. Right. If you have any questions regarding the nutrition part of it, okay, just drop us a message on the YouTube chat, and then we will pick it up and we will answer it at the end in the Q&A session. Now, is there anything else you would like to add, Dr. Anupama, here?
Yeah. So in lifestyle medicine, when it comes to nutrition, we focus mainly on eating high fiber diet. It's mostly predominantly whole food, plant-based is what we say. That is not to say that you don't eat any animals, but just that, reduce the quantity of it because, or avoid it altogether because eating, meat, a lot of meat is associated with increased risk of gut cancer and breast cancer. So we need to have sustainable weight loss, which is more possible when you have a fiber-rich diet. There's no doubt about that. Yeah. So in terms of nutrition, that is what we usually ask them to do. So eating out of a round circular plate, let's say half the plate should be full of fruits and vegetables. In the other half, it could be carbs and proteins. Then, again, watch the portion sizes of what we are having. Stick to whole grains, not refined grains, as you mentioned. And the protein source should be a good quality protein source again.
Right. Okay. So there is a slight deviation here. So I mean, the when you talk about meats and then the implications for cancer. So I mean, the data mostly is from the US and the other Western countries. So their way of dealing with meat and cooking meat is completely different. Now there is one study which also says the spices in the Indian sambar is actually protective against the colon cancer.
Yes, very true.
Yeah, and when we talk about the red meat, there is this talk about nitrates causing the cancers, right? But then these are produced when we char the meat by grilling it and, for example, baking it or frying it. So frying is not really a good cooking method. So the Indian variety of cooking, in fact, which includes a lot of broiling and boiling and steaming, so that is supposed to be very, very beneficial. So the focus here is should not really be entirely on meat per se, but also the way it is cooked and processed, isn't it? So we do not have any kind of canned meats in India, isn't it? So that's more like of the West. And anyway, thank you for adding. And so coming to the exercise part of it, now most people do not really understand the difference between physical activity and exercise, right? Now, physical activity is nothing but you keep moving. That does not amount to exercise. Your housework does not amount to exercise. That is completely different. Okay, if you are going to tell us that, okay, so I do a lot of housework, but why am I still putting on weight, right? So that is physical activity. Okay, so keep moving. Okay, so you can use this rule of 55 and 5. Okay, every hour that you work, 55 minutes, focus on your work. Okay, get up from your seat for 5 minutes, just take a walk around. Okay, so that is a strategic way of using physical activity in disease prevention. So you can say that is an exercise medicine in itself, right? And other way that you can use is that exercise, the physical activities, walk 1,000 steps after every meal. It actually improves your insulin sensitivity, which is the cause of metabolic dysfunction, right? So that is a very simple strategy that you can use and which has got a lot of benefits, right? So walk 500 to 1,000 steps post the meal. So this is about your physical activity. But coming to the World Health Organization recommendations, you need to accumulate about 150 minutes of of exercise. Now it can be in 30 minutes, 5 days in a week for moderate intensity, or it can even be 20 minutes into 5 days for vigorous intensity. But most of us are not able to do the vigorous intensity, so we can stick to 30 into 5. Now this is the recommendation and the minimum for maintaining health. Now there is more benefits for higher amounts of exercise, but then that does not mean that you kill yourself on the treadmill for 2 hours in the gym, right? All you need is 30 minutes and it should be strategically used, which means your exercise should be prescribed for both quantity, quality, and duration and the type, right? So coming to the a few things like yogasanas. There are particular yogasanas which actually help in reproductive health. Okay, so just drop in a message, reproductive yogasana for reproductive health, and then we will tell you what are the kind of asanas that you need to do, and it will help you for PCOS. Right. So this is about exercise in PCOS, and coming to the lifestyle. Major thing is sleep. If you do not sleep, then there is no way that you're going to see any kind of result. Now, if this result may be the reversal of your metabolic dysfunction, it can be a change in your symptoms, it can be a change in your weight. You are not going to see any difference if you uh, are not sleeping for a minimum of 7 hours per day, right? So now these days there are advanced sleep trackers. Like, I mean, you can just wear a watch and go to sleep, and it will tell you how good is your sleep. Or there are things which go under your mattress and monitor your sleep. So there is no dearth of trackers, right? Okay, so it is just that we need to make that effort to throw away the mobile or switch off the TV and then go to sleep, right? So we can use music as therapy or aromas as therapy. Okay, so to help us in sleep, right? And the second thing in terms of lifestyle would be managing your stress. Now, stress, although in biochemical terms we say when you have stress you release cortisol, and then it causes weight gain. But then the way stress works is multifactorial, right? So it creates a lot of biochemical abnormalities, and then it causes disease. The root cause of many diseases are stress. So identify your causes of stress. Do something about it. Don't brush it under the carpet. Okay, so identify your coping mechanism of stress. Okay, start writing a gratitude journal and make real connections. I mean, you might have 5,000 friends on Facebook, but then no one to speak, right? So make real friends. You can have one friend, two friends, three friends. Just a close circle is enough. Okay, so that you have a shoulder to cry upon, and then sublimate your stress, right? So that it does not hurt you within. So that is stress, right? And also the third part is the detox. So most people ask us about what is the detox for PCOS. Best detox is fasting, and it is free, right? So you need to fast for a minimum of 12 hours every day, and you can increase that up to 16 hours, and then maybe do a 24-hour fast for once in a week or twice in a week, and then thereon as you start seeing benefits. No, this is not equivalent to eating less. We are not asking you to eat less. You can eat more and then still gain good results, but fasting has its own benefits in a different mechanism, right? So it in fact promotes reversal of aging through a process called as autophagy. It kills your old and senescent aging cells, and then it starts using the byproducts, and then it creates new cells, which means you rejuvenate from within, right? So that is the effect fasting can have on you. Then the worst parts: smoking can kill you. It not only causes your lung cancer and other kinds of cancer, but it also causes main reason in PCOS: alcohol. Minimize your alcohol intake. So these are the lifestyle modifications you need to do to manage your PCOS. Have I left out anything, Dr. Anupama, according to your...
I think in exercise, I would like to add about strength training. I thought you didn't mention strength training. So at least 3 days of endurance training and 2 days of strength training is very important, especially for women, because and with PCOS. So there is something called lean PCOS, right? We see a lot of women, some of them are not obese, but they can still have PCOS. It's because these people may still have an excessive body fat. The fat percentage might be much more than the muscle. So it's important to also be aware that BMI is not the best indicator. And also our Indian BMI standards are different from the Western. Yeah. So in our case, BMI between 23, anything above 23 is also considered grade 1 obesity. So yeah. So that's important to keep in mind.
Yeah, that's a very good point that you made there. I missed out on the strength training part. Yes, you need to lift weights or work against resistance so that your lean body mass increases. Okay, if you're focusing on only one kind of exercise, let's say if you say I run, but I'm still unhealthy. Running is just one form of exercise. It is an endurance exercise. So running, cycling, swimming are all endurance exercise wherein it works on your cardiorespiratory fitness, but it does nothing to actually add to the bulk of the muscle or the lean body mass. It does not make your bones stronger or your muscles stronger. So your metabolic health is directly proportional to the amount of muscles that you have, because muscles are something tissue which requires a lot of energy. So even temporarily, if you go into energy excess, it just absorbs it. So put on some muscles, okay, and uh, add some weights, lift some weights, and pull something, push something, okay. So become stronger, okay. So that is the essence of it, right? So Seema, we are done with our part of the talking. So if we have some questions, we will be glad to answer.
Yes, sir. Thank you, Dr. Bharath and Dr. Anupama, for such a lovely session. So we do have many questions coming up for us. So firstly, there is a first question asking about how do we prevent PCOS in young girls?
Yeah, sorry. So yes, prevention is always better than cure, and I would say prevention is with lifestyle. Make sure that the child, the young person, is getting adequate exercise, is eating nutritious food, getting adequate sleep, isn't getting too stressed out. Their relationships, their friends, how is that going? If need be, the best way is to manage your lifestyle to prevent it from coming. That's what I would say.
Okay. And sir, we have a question related to insulin resistance. So, how do we test for insulin resistance? Do we have to go to hospital, or is there any blood test to be done?
Right. So insulin resistance is basically that your body is producing excess insulin, but at the same time it is not being utilized at the cellular level, right? So for this we measure two things. One is the fasting insulin and the fasting glucose. Now there is a derivative of this test called HOMA-IR, which is homeostatic model of insulin resistance test. So which tells us how much is your insulin resistance. Now this is both a diagnostic test and a prognostic test. Let's say your initial is 5. Okay, as and when the therapy you start the therapy, it should actually decrease. The quantity of basal insulin drops and also your blood sugars drop. And the other test is your HbA1c. Now HbA1c is an average of your blood sugar for the last 120 days. So measuring three things: one is fasting glucose, fasting insulin, and HbA1c is a measure of insulin resistance.
Right. We also a glucose tolerance test in pregnancy, especially between 24 to 28 weeks of gestation, because these women are more prone to develop diabetes, gestational diabetes. And somebody who is diagnosed with PCOS, the recommendation is, if at all there's a very strong family history of diabetes and they're over 40 years of age, even if they are not obese, it's a good idea to have a glucose tolerance test annually, actually.
Right.
Okay, that's very informative, Dr. Bharath and Dr. Anupama. So we have another question, like how many of your PCOS patients have been associated with fatty liver?
Oh, it's quite common to find non-alcoholic fatty liver because of the overweight, because of the lack of nutrition. It's very, very common to have non-alcoholic fatty liver in case of.
So they are all brothers and sisters, or we can say cousins. So diabetes, hypertension, and high cholesterol, PCOS, and fatty liver, they're all, the root cause of everything is the same. The moment we reverse insulin resistance, everything drops down.
Absolutely.
Okay. So, ma'am, we have one more question. This is completely clinical, I guess. So, would you recommend PCOS patients to freeze their eggs just in case it takes times to correct a PCOS in patients who are 30 plus years? So, late diagnosis of PCOS while racing against time. So looks like this is a doctor who is asking this question.
We don't recommend everyone to freeze their eggs. No, we would say please manage your lifestyle, and you can still get pregnant no matter what, unless they have a very low level of AMH. Maybe these are considerations that I think it's best to talk to an infertility specialist about.
Okay, thank you. So we have another question related to PCOS symptom. So there is a woman who's asking, my daughter suffers from severe cramps. So how do I manage it, and what should I be doing?
Okay, so dysmenorrhea again is extremely common. Especially, you will notice that painful periods are begin after like 2-3 years of getting menarche, right? The first few cycles, these children will not have pain, but later on the pain starts. It's because of ovulation. Ovulatory cycles usually cause release of prostaglandins, which is what causes the cramps and the pain. So couple of things that help is, of course, lifestyle management. Adequate nutrition and exercise is key. It helps boost mood, and it helps manage these cramps also. Apart from this, we do give medications sometimes. So pain relief medications can be given if nothing else has worked, and if this particular child has tried everything. You can even use hot packs during that time. But if it is very severe, then we can consider medications. We can even give oral contraceptive pills because they prevent ovulation from happening. And usually when they are on these pills, the period will be painful.
How about if the child is too young, and or do you still recommend oral contraceptive pills?
Oral contraceptive pills are okay to use. How young is too young? I'm not sure, because precautious puberty is very, very common again these days. We are noticing that children as young as 8 and 9 are getting periods. So definitely somebody who's getting menarche at such a young age should see an endocrinologist to make sure we're not missing out anything, and then only consider, probably menstrual suppression if it comes to that. But oral contraceptive pills in teens are given for about 3 to 6 cycles just to help them cope, to make the lifestyle modification required, because with lifestyle modification it can be brought down. Many of these kids will be overweight actually.
Okay. Hope that answer helps the mother who's asked the question. So Dr. Bharath, we have one question to you. So there is a question asked by a doctor. Do you look into skeletal muscle challenges, which is low muscle mass and strength, in patients with PCOS? The idea being that skeletal muscle is a central character in insulin resistance.
Yes, definitely. This is a classical presentation of what we call as sarcopenic obesity. Now, sarcopenia is where there is less lean body mass, and obesity is again if there is more fat. So both combined together, they have the double risk. So yes, it does play a vital role. So that is the reason when you are losing weight, or if your attempt is to lose weight, it is very important that you track your body composition. Now it tells us that whether you are losing fat or your muscle or just your water. You can lose 10 kgs, but then the drastic side effect would be that you would have gained some fat and lost your bones and water and muscles, and then that has a detrimental effect. So you might see a difference, but then it is not really healthy. That is not healthy fat loss. So yes, the muscle mass and the fat mass are two very vital parameters that need to be tracked in the fat loss journey.
Okay, thank you, sir. So we have another general question. Usually sugar is avoided in all the diet programs. One is that. And secondly, why is sugar avoided, first of all? And most of the PCOS patients have, or clients or girls have a symptom of sugar cravings. So how do they address it at home itself, or is it something to be more concerned about?
All right. So I see Dr. Anupama smiling. You want to take that?
No, that's okay. You can go on. I'll add on after you.
All right. So basically, sugar is again a refined carbohydrate, and it first thing is it spikes your insulin. Now, when we are in the pursuit of reversal of insulin resistance, we don't want an unnecessary spike. Whereas if it is a complex carbohydrate, there is literally no spike. It is just a plateau kind of a shape. So that is the first thing. So yes, certain people have sugar cravings. Now these cravings, be it sugar or salt, are uh, because of mineral deficiencies. The moment we replenish the minerals, the cravings actually stop. So it is very important for them to add some fruits and vegetables and uh, nuts and seeds. So these are the things which replenish the minerals.
Yes, absolutely agree with that, Dr. Bharath. So definitely, I have noticed that if sugar is one thing that everybody knows. Pretty much everybody knows avoid refined sugar. But salt, again, there's not enough awareness because salt also increases the cravings. So avoiding excess salt is, so the recommendation actually is per plate, the amount of salt that we should be having is probably like a pinch of salt. That's it. So definitely, it's important to avoid both. And as you mentioned, Seema, one thing is emotional eating and stress eating in young girls around the time of the period. It's probably happening to all of us to some level, to some extent. So it's common to have that, feeling a little low and emotional and wanting to eat something sweet and craving for that just before your period comes on. It's called premenstrual syndrome, what we say. Again, quite common in women with PCOS. Which again can be managed to a large extent with all the lifestyle changes we've discussed. So even those cravings will come down if you get adequate nutrition and exercise. Yeah.
Okay, I'll add something here. So now when we talk about salt, these days everything is refined, isn't it? Even the salt, I mean, typically we used to use sea salt or the rock salt, which was like straight from the sea, and then it is not just sodium and chloride. It used to contain a lot more minerals. But then because of the process of refining, we are simply adding only sodium and chloride, isn't it, in the refined salt. But in the rock salt, there is also potassium, which also decreases the amount of blood pressure. So it's not really the salt per se, but it is the refined salt per se that is the problem.
Right.
That's very informative, Dr. Bharat. So thank you, Dr. Anupama, for the answer. So we have another question asking about seed cycling. What is the ratio that will help in seed cycling and in regularizing the cycle?
Right. So seed cycling, I'd like to mention here that I've also seen a lot of women and patients benefit from seed cycling, but there isn't enough research and there are no randomized control trials to say that it works for sure. Right? We don't know how effective they are. So in the first 14 days of your cycle, it would be flax seeds and pumpkin seeds, 1 tablespoon each of flax and pumpkin seeds. So if your period starts today, from today, the next 14 days, you use that. And in the second half of your cycle, you use sesame seeds and sunflower seeds. Again, 1 tablespoon each. But in general, I would say it's good to include seeds in your diet because they're a great source of fiber, rich in magnesium, copper, manganese, many of the micronutrients that Dr. Bharath was talking about. So there's no harm in taking it. Yeah. So this is usually what I have read about seed cycling, and I've seen many patients benefit from it.
So it's definitely worth a try.
Yes, it's worth a try. There's no harm in it. So.
Right. Thank you. So we have another question, Dr. Jayanti, gynecologist, asking from UK. She's asking what proportion of PCOS patients have normal BMI in India, and how do you explain PCOS in them? Is it genetic?
It could be very well genetic. Sorry, can you repeat that? What percentage of women?
What proportion of PCOS patients have normal BMI in India? Okay. And how do you explain PCOS in them?
Okay. So lean PCOS is quite, I wouldn't say rare, but it is uncommon. Most women do have higher BMI actually, anything about 23, as I was saying, in Indian standards. So lean PCOS, like I said, it's very important to do the waist circumference because they might be looking lean, and as we discussed, BMI is not the best indicator, right? They might still have excessive body fat, and that is the source of the problem. Excess body fat can, amplify the hormone imbalance, which is probably why these women can still have PCOS. And yes, there is a genetic link to this, definitely. Dr. Bharath, do you want to add something?
Yeah, so now when adding to your point of excessive body fat, now the body fat actually has an enzyme called aromatase. So now it converts the hormones into excess estrogen. Right now, there is an imbalance of excess estrogen, and estrogen to progesterone ratio gets altered. So even though the person might look clean, see, these days we are all, the women are all looking for looking like being zero size, isn't it? So the high waist, low waist concept. So they want to be lean. So irrespective of whether they're healthy or not. So yes, so the fat releases something known as adiponectins, so which are again the hormonal mediators. So that creates a havoc in PCOS. So BMI is not really the best indicator. So all the doctors around the world, okay, they really need to delve into monitoring body composition rather than just having a weighing scale.
Right.
So we have two more questions, which is kind of elaborated one. They're asking for how do we prescribe a diet plan using BMI, which doesn't really apply, is what I'm understanding through the conversation. And the second question is what is the role of exercise and yogasanas for reproduction, better reproduction?
So, so about the first part of the question, so we will in the coming days talk about what is wrong with the Indian diet per se, and then how do we fix it, and then the other topic would be how do we make a healthy diet plan, a step-by-step approach. So we will answer that question there. So they need to stay tuned. And coming to the exercises and yogasanas, so there are some particular yogasanas which actually help in reproductive health. So we'll just drop in the list. Okay, there's a long list. We'll just drop in the list in the chats.
Right. Thank you, Dr. Bharath. So I think that's all for today's question Q&A session. So anything else that you both want to add up?
Yeah, go on, please.
Yeah, so I would just say lifestyle is medicine. That's my take-home message for everybody. So please manage your lifestyle such that you can prevent most of these metabolic conditions, which, non-communicable disease is on the rise even in India, and it's one of the main killers. And with the right kind of lifestyle, we can even prevent, you can use lifestyle to treat it and sometimes even reverse these conditions. So it's important to be aware of that and focus on our lifestyle. Thank you.
Right.
Thank you, Dr. Anupama.
Yeah, so what I would finally like to say is, most people, when they say, I don't have time. If you don't make time for wellness, you will definitely have to make time for illness. You might have a lot of money to pay for the hospital bills, but who pays for your suffering, isn't it? So no one pays for your suffering. So don't even get into that. So get 1 hour, which is just 4% of your day, and for yourself, and work on yourself. And anything that you do in life, be it nutrition, be it exercise or lifestyle modification, has to be based on a goal, right? So don't get into these calorie counting things. So that is not important. So focus more on getting yourself educated, and then the right kind of get the help of a right kind of specialist.
Yes, that's a very informative session and a good message. So I thank you both for your time and knowledge shared. It is worth for today's Sunday morning. And I encourage all the audience to post your questions in the comment section, and to get any of the information or consultation, please contact us. I would also post the number. You can note it down. 888-44-33844 is our clinic number. You can always reach out to us for any queries, especially anything related to lifestyle conditions. Thank you, Dr. Bharath and Dr. Anupama.
Thank you, Seema.
Thank you. Thank you, Seema. Bye, everyone. Have a nice day.
Thank you.
Yeah, you too.